Hey everyone, it's Anne Sinclair from Digestive Detective. Hope everybody had a great weekend. Today I want to talk to you about everything you need to know about poo, essentially. And I know it's early, sorry if anybody's having breakfast. I just thought I'd get it over and done with pretty quickly. So, what is poo, essentially? Well, most of us think of poo as leftover food that we eat. But it's a lot more complex than that. So poo is about 75% water. It's higher in vegetarians as they eat more water-based fibre foods. So it's 75% water. It is living and dead gut bacteria and viruses and anything else that's in the gut. It's old intestinal linings, and it's the breakdown of our medications, our estrogen, our old cells and undigested fats that are swirling around in our body. So when you're constipated, it's not a good thing because you're recirculating all those estrogens and undigested fats and old cells and medications and stuff, which can make for not a good place for your gut to be. It makes it toxic, essentially. So the perfect poo should be quick, easy to pass with no straining. There should be no mucus and no pain. You should have a feeling of complete emptiness after a really good poo. And there's actually a term called poo-phoria. So I know cats get it. Thanks, Maureen, for that. But adults, humans can also experience poo-phoria. So this is where a poo triggers your vagal nerve, which is the wandering nerve right around your body. And it induces a feeling of exhilaration and intense relaxation. And some people can even get goosebumps from poo-phoria. So it's something we should probably all aspire to have daily. So the colour of your poo, what should it look like? Somewhere between mid to dark chocolate brown. So I always tell people some milk chocolate to dark chocolate sort of colour. The colour comes from a brown pigment that's formed in our bile called stercobilin. So different foods we eat will affect the colour of your poo. So different colours of the poo also mean different things. So if you pay attention to what your poo looks like over a period of time, and if you notice the colours changing, think about what you're eating, and then also if it's changing dramatically and consistently changing, it's worth seeing the doctor about it. So some colours that you might see are white or a clay coloured poo. These sometimes happen with anti-diarrhea medications, or it could be a bile duct blockage. So if you have that, you'll normally have other associated symptoms like fever and pain, jaundice perhaps, nausea, vomiting, those sorts of things, and weight loss. So this is a sort of, you go to the doctor immediately if you have these sorts of things. Yellow poo that's greasy and smelly can be a sign of malabsorption. So it generally means you have excessive fat in your stools, and you could have a malabsorption issue like Crohn's disease or celiac disease. So again, that's worth getting checked out as well if you're noticing a change. Green poo can mean that food is moving really fast through your large intestines, and your bile is breaking it down quickly, or you've been eating too many foods that are green foods for starters, or foods that have lots of green food colouring in them. So check that out. A couple of red poo is the next one. So red can mean you have hemorrhoids. It's generally what's happening in the lower bowel. So hemorrhoids are fissure or bleeding, and if it's bright red, that's normally what it is. Or if you've been eating excessive red foods like beetroot, if you're a beetroot lover, or foods with lots of red food colouring. Again, if there's bright red blood on the toilet paper, it's worth going to have it checked just for your peace of mind because it freaks you out a little bit. Black poo can be bleeding from higher up in your stomach, and you should go to the doctor straight away with black poo. Hi, Irene. So with black poo, it can also be if you supplement charcoal, so think about this, or you eat lots of licorice. It's worth checking that out. But normally black poo means it's been in there for a long time and needs to be checked. It could be, and if you're deficient in iron, it could be you have a slow drip from somewhere, so it's worth getting that checked out, or you've got a bleeding ulcer or something like that and it's just dripping, so that's worth getting checked out. So if you consistently have a colour that strays from mid-brown to dark brown, go and get checked by your doctor just for your own peace of mind, because it can be a bit disconcerting when that happens. The smell of a poo is impacted what we're eating. Poo shouldn't be offensive if you've got a really healthy diet. So if you find that your poo's not a natural smell and you're having, a really bad smell, then that's worth getting checked out, because you could have a parasite, malabsorption issues, or even unbalanced gut bacteria will make you smelly. If your poo is frothy and greasy, this can be a sign of you not digesting fats. So there's some things you can do around that. So should your poo sink or float? Well, I say it should be a little bit of both. It should be the perfect poo sits on the toilet for a few seconds, and then it sinks slowly to the bottom, because it means that if it sinks, it means that you've got plenty of fibre, that you're eating plenty of fibre. But if it floats, it means two things: you're not eating enough fibre, or it's full of gas. So be mindful of that. The perfect poo should sink. It shouldn't disappear so you never get to look at it. It should sink into the bottom of the toilet. Clean up. So when you are finished your poo and you've had poo-phoria and all that stuff is going on, clean up should be easy. It should be one wipe and it's clean. There shouldn't be constant cleaning. It shouldn't be sticky and messy and take a lot to clean up. So there's a couple of things that you might want to check if it's not clean, is how you're sitting on the actual toilet. So I recommend people get a stool, and it doesn't have to be a squatty potty or any of those things. A little $7 stool from Kmart is perfect, and put it underneath your feet so your thighs and your hips are thighs are parallel to your hips, or even a little bit higher, because that opens the valves. You have two valves as it comes from your descending colon into your rectum, and those valves are when you sit on the toilet, they're actually squashed shut, so it's harder to do a poo. Whereas if you put your feet up on a stool, they both open spontaneously, so that makes it much easier to have a poo and have a really good poo. And that's why in a lot of developing countries they still have the squat toilets, because that's the perfect way to have a complete poo. It goes from the whole ascending, descending colon right through, and it's a much better elimination experience. So some things that can affect your poo. Most of us have issues when we travel. And that can be from different time zones, not drinking enough water, being out of your routine. These things are all enough to throw your poo schedule out. Medications will also, sleep issues will also throw out your poo. Hormones, stress, surgery, anything like that, a change in your daily routine, or if you're rushing and you're not thinking about it, change in your diet can also affect your poo schedule. So poo makes a lot of us pretty squeamish, and it's really a subject that most people don't want to talk about. But it can be really a good report card on what is happening for you. Hi, Mina. And how you're digesting and assimilating food that you've eaten. So it's wise to check what your poo looks like. So be looking that there's no food, it's easy to pass, all those sorts of things. Aim for poo-phoria, people. That's what we want. And so it's best to look back when you flush. And I know a lot of people don't, because I ask this question all the time about poo. I ask these in-depth questions, and a lot of people can't tell me. Hi, Mina. Yes, it is a happy Monday. It's good to be back at work today. So one of the things I think about poo is your life depends on it. I see so many people who have had blood in their stools and they haven't gone to the doctor straight away. So if this is you, do that. Go and get peace of mind rather than let it sit in the back of your head and not do anything about it. It's worth doing. So I hope that's been helpful. I look forward to chatting to you on Wednesday. I'm not sure what the topic will be yet, but I'll find something for us to talk about. Drop some suggestions in this live if there's something that you specifically want me to talk about, and I'll get on to that. So have a fantastic day, everybody. Hope it's a good one. I'll talk soon. Bye.